Hi, I'm Dr. Andrew Goldstone. I'm a pediatric heart surgeon here at Columbia.
Hi, I'm Dr. David Kalfa. I'm a pediatric cardiac surgeon here at Columbia University as well. So we are here to talk briefly about the concept of partial heart transplant or allogenic heart valve implantation. Currently, all the options to replace a valve in a child are actually not optimal because these valves do not have any growth potential, degenerate, or need blood thinners, which is a lifelong medication.
So, allogeneic valve transplant or partial heart transplant tries to circumvent some of these limitations by instead of transplanting the whole heart, we can take parts of a donor heart, such as the aorta or the aortic valve, or the pulmonary artery and the pulmonary valve that sits inside of it, and transplant just those parts into a person that doesn't need a whole new heart, but maybe just a new valve. And those valves are alive. So if we remove the front of the heart here, we would not do this in real life, but if we remove the front of the heart, you can see inside the heart. And inside the heart, you can see that there's two outlet valves. One is the pulmonary valve, which is here, that empties out blood to the lungs, and one is the aortic valve up here that empties blood to the body. So Dr. Kalfa and I can harvest these valves with their corresponding artery and use that to replace diseased pulmonary valves or diseased aortic valves.
And this partial heart transplant is really disruptive and can be game changer because it can really help with avoiding all the limitations of the current options. These valves indeed are living structures, which mean that they have a potential for growth and self-repair, which means that this option could potentially avoid multiple reoperations down the road at the expense of having a slight immunosuppression therapy.